Welcome back. Welcome back to Living in Mexico. I'm Ana Maria Salazar. Thank you. Thank you so much for joining us. I want to thank all of you who've been joining us throughout the years. It's always an honor to share with you information, news, analysis about what's going on in Mexico, both in English and in Spanish. And it's been a very busy year for so many reasons. I can't believe we are where it's almost Thanksgiving. I mean, literally, the year's almost over, and we're still struggling with very similar issues that we were struggling a year ago. And it has to do with what's going to happen with COVID, what's happening with Mexican politics, what's happening with the economy. I mean, it just seems that the issues are similar, but in generally speaking, there's a sense that things have improved enormously, or at least that's the way we're acting. I mean, I think when we look back what was happening a year ago, we were facing once again a new wave of COVID-19 with restrictions that were affecting all of us. But at the same time, a lot of expectations, a lot of hope that people were being vaccinated and things would change. Things have changed, but the question is, what will happen a year since we've been since we had one of the largest waves that affected so many people. What's going to happen with COVID-19? And then, as you've listened to some of the guests who've been joining us in the last couple of weeks, there's a lot of conversations in regards to the influenza, and the influenza that is apparently hitting quite with a lot of strengths in different parts of Mexico and in the southern part of the United States. So that's why I appreciate today's guest. You know him well if you've been following this show throughout the years. He's Dr. Ilian Shapiro. He is the chief. He has this really long title, but it's a fascinating title because of all the things he does. He is the chief health correspondent and medical affairs officer at Altamed, which is this NGO out of Los Angeles, California. Doctor, once again, welcome to the show. It's great to see you. It's great to have you back.
Thank you so much, Ana Maria. It's a pleasure. And it's hard to say it, but we are in 2022. And a lot of things have changed and a lot of things we have learned. And there's a couple of them that are still giving us headaches.
Yeah, and that's one of the reasons why I wanted to talk to you this morning here on Living in Mexico. I just read this week that in the county of Los Angeles, the government, the local government, is recommending people once again to mask up in enclosed areas, which was somewhat surprising, knowing how controversial the issue of using face masks has been in the United States. This idea or this conversation has not come up in Mexico yet. And of course, everyone decides whether to mask up or not. But the fact that you have in Los Angeles, we have to remind our audience, one of the cities with the largest Mexican and Mexican American community in the world, has now, officials are deciding that it's time to mask up again, with all the political and health implications of this recommendation. Could you just give us a sense what is happening in your county, in Los Angeles, and maybe help us understand what's going on in the United States in general? Once again, Doctor, welcome to the show.
Thank you so much. Well, a couple of things. The mass right now is a reflection of a couple of things. LA County, it's the neighbor to the north of Orange County. Right now, Orange County has been seeing a spread of a lot of something that we call influenza-like viruses or illnesses. This is a referral of anything that feels like a cold, that's giving fevers, runny nose, coughs that comes in the winter. That's kind of the general definition. But most importantly, they have been seeing a lot of patients ending up in the hospital with something that we call in English RSV, that's a respiratory syncytial virus, and also early onset of influenza, and the COVID cases are going up. Then we are having something a lot of people are calling the triple endemic factor or trifecta, where a lot of the hospitals are starting to get burdened because of the entirety of people that are ending up there. And it's so early on the season to start having these issues. Even with, in 2020 or 2021 with just COVID, it usually was at the end of November when we started to see the spike, December, and will go actually down in January. But right now, these three viruses are giving a lot of headaches to the healthcare system, specifically for LA County. We are seeing almost a doubling of COVID-19 cases. Influenza is actually rising. Even before the pandemic, during the pandemic, it feels that RSV, influenza went on vacations, but right now they came back with a mighty force, and we are seeing more cases in an early aspect, and we are worried about that part.
So, I'm just trying to extrapolate from what you just said as to what should we expect for the next couple of weeks, for what's the remaining of this year and the beginning of next year. I mean, and the reason why I think it's so important that from Mexico, I'm in Mexico City, you're in Los Angeles, we should be looking at what's happening in Los Angeles, is that there is that interconnection. There's going to be a lot of movement of people. There is already a movement of people during these holiday seasons, going back and forth between both countries. And of course, clearly, whatever peak of any disease we see in the United States will eventually be having or feeling the effect in Mexico. So what do you think, or what would be the best case scenario or the worst case scenario for the next weeks?
Let's start with the best case scenario. We create more barriers, and that means that we start eating better, we sleep better, we do exercise, we stop smoking, and also we cater ourselves with a couple of other things to teach our body how to protect itself, and that's the influenza virus vaccine and also the updated vaccine for COVID-19. Then those are the things. And for Mexico, getting the booster shot. The third level will be to make sure that if we have we're in a tight space with a lot of people, poor ventilation, we need to open the doors, we need to open the windows, making sure that we try to do gatherings in an open space. That actually reduces the amount, not just against COVID-19, but the risk of other viruses. And very importantly, to use the treatments that we have. If we use the treatments that we have against influenza and COVID-19, the antivirals, that actually reduces the amount of people that end up on the hospital, complications, and sadly, the ones that we have been losing due to these infections. And that's kind of the best thing. And also because we started early, we should finish late, like early also. Then that would be my wish list for Christmas. What can actually start happening on the worst case scenario? The worst case scenario is that right now we're tired. We're tired about hearing about viruses. We just don't care. We had a horrible 2020 on the holiday season. We had a less horrible one on 21. And right now we just want to celebrate the way that we have been celebrating the past 8 months. We do not hear or use the mask whenever we, in close, tight spaces. We gather with a lot of people, and we just don't use any. We go out there when we're sick, and all of these actions can actually implode in a healthcare system that we don't have a lot of doctors. We lost a lot of doctors, and through burnout, and actually a lot of doctors actually died because of COVID-19 and just like run away from the field. And the same thing with nurses, and therapists and technicians and everybody else around the healthcare stuff. Then it's not that we have more manpower than in 2020, we actually have less. Then if you put on top of that we have a finite number of beds on the hospitals, finite number of humans and resources, and you add influenza, RSV, and COVID-19 attacking at the same time, it's a bad combination.
Yeah. Wait, could you explain to our audience the term RSV? And how does it differ from COVID and influenza?
At the beginning, influenza, RSV, and COVID-19 and a common cold can actually look the same. The thing about RSV, that it's actually the respiratory syncytial virus. It's a virus that it's not new. It's very important to clarify it's not new. It actually was discovered in 1956. it attacks usually younger kids, usually that are premature, have problems with their lungs, heart stuff. Those are the ones that actually get complicated, and adults that are more than 65 years of age. Those are the major, the ones that can be harmed more often via the RSV. But these are very common virus to the point that most kids, when they are 1 year of age, they have been already exposed to the virus. And the key here is that at the beginning, most of the kids will do fine. But the thing is, it jumps very fast from a kid to a kid. The cough is lingering. It can last for weeks. It's a very harsh cough. The all the, los moquitos, the mucousy stuff, it's very hard, and kids do not want to eat. They feel horrible, and they can share, of course, the gift with with the parents.
Right. And but the RSV is more focused, or the concern of RSV has to do with younger children that are ending up in the hospital, correct?
Right now, it's also attacking adults. And the mortality part of it, it's actually younger kids below 5 years of age and adults more than 65 years of age. Then it actually has that part, the same thing as influenza and COVID has attacked both. The mortality rates with influenza with kids is actually way lower, but RSV, it's there and has been giving us a lot of headaches. And sadly for RSV, the problem is that it came early, probably will last until April. And the problem here is that for RSV, we do not have a vaccine and we do not have a treatment for it.
Now, well, joining us today is Dr. Ilian Shapiro. He's been joining us since this whole COVID-19 crisis initiated 3 years ago. It's going to be 3 years. It just seems that time has gone by so fast and things have changed so fast. Let's talk about this the name that they use for this latest strain of COVID-19 in Mexico is El Perro del Infierno or something like that. It's a horrible name and it's very scary. How concerned should we be in regards to this new COVID-19 strain that is now circulating in the United States? It's here in Mexico, and I'm sure it's going to be an issue. But is it any different than other strains? Should we be more concerned, less concerned?
In order to answer that part, we need to go back on how viruses actually reproduce and what happens there. For specifically with COVID-19, it goes inside of our cells, and we are the best industry of COVID-19 in the world. Then it needs a human to replicate. Then it goes inside of us. Inside of our cells, they have three choices. One, they reproduce and they have too many errors and they just die. And that clearly has not happened. The second one is that during that changes, and when they're reproducing, it learns how to kill us faster. And thank God that hasn't happened yet. And the third one, that usually that's the way that it works, is that it really doesn't want to kill us, but it wants to replicate faster. That way it spreads more and actually infects more people. And that's what we have been seeing from the original, like death toll from COVID-19 until Delta, Omicron. It has been more contagious, less deadly, still giving us a lot of problems. Prolonged COVID will be a headache for a couple of decades. But right now, the thing that we for at least a decade. But right now, the thing that we're seeing, especially with the variants, is that we are afraid that one of them will escape from these cycles. And actually, all the things that we have done, from the viral, antiviral advances that we have done, the antibodies, and also the vaccines, can actually escape the way that we defend ourselves against this virus. And we are worried about that part. The good news is still Omicron, the family of Omicron, because right now we have an entire soup of letters that are BA1, a lot of things. It's still the vaccines that we have still cover against that part. And also most of us have already been exposed to the virus, and that actually even boosts our natural immunity even better. Then the best combination is that.
Wow. The what do you foresee for next year? I mean, let's talk about best case scenarios. What's going to happen next year? I mean, and the reason why I ask you this is because if you watch the political communication of the Mexican government, and I would even say the US government, I mean, they're not talking about COVID-19 anymore very, very much, at least here in the we have to recognize that the Mexican government, they were providing daily, they had a daily press conference, and then they were providing daily information in regards to the number of COVID-19 cases and infections and deaths and hospital capabilities. And now we're at a point where the president's just announced a couple of weeks ago that they would not talk about COVID-19 numbers at all. It was not going to be referred to, and it was not going to be present during the press conferences. And when they talked about health issues, it would be about the other programs that the government is implementing right now. So COVID-19 is just not being discussed very publicly right now. That's why I thought it was very interesting to hear that the government of the city of Los Angeles was recommending people to mask up inside when they were in closed quarters. I mean, so I'm just trying to get a sense what this is going to look like next year.
I can tell you the full story when we have more information by March, because this will be our third cycle of spikes, and it's not the wave, but actually like the winter time. Then with the information that we have from 2020, 2021 that we started vaccinating, and right now 2022 that we have more opportunities and options, and also Omicron, we probably can start getting some predictions and actually good value data that it's actually valuable by March. Why? Because that way we know how well the vaccines worked and how important is certain things. Then I do think that the way that it's working with COVID-19, it will be, and it's already endemic. It will be something that we'll be having every season, and probably there will be a vaccine every year to actually help our body reduce hospitalizations, and probably they will cater the same way that we do for influenza, that we see Australia to see how bad or good was the season, and after that they kind of try to match what's the virus that is more common, and that way we're exposed to it via the vaccine and get that protection. I think that's going to be happening on summer of 2023. I do think and foresee that a couple of things. If we see that the virus continues to give us headaches, and the mortality rate is high, and the burden on the healthcare system is high, if we are seeing more prolonged COVID, and if we're seeing more variants, I think that getting the protection and the updated vaccines every year would be worth it. If suddenly we see that this vaccine, the updated vaccines are amazing, and this season, even though that there were a lot of cases, not a lot of people ended up on the hospital with complications with COVID, including kids, I think that we can actually foresee not using that vaccine that much. My best feeling here is that probably COVID-19 loves us, and it doesn't speak human. And every time that we open the door, we take away the mask, we are gathering with more people, we are kind of, doing things that we do not necessarily need to do. I think we'll stay here for a long time.
For a long time. Well, with that, I really appreciate you joining us, Dr. Ilian Shapiro. He's in Los Angeles. He works, he is the Chief Health Correspondent and Medical Officer at Medical Affairs Officer at Altamedis NGO of Los Angeles, that provides services to the Mexican American community. So it's always great to have you on our show. Thank you so much for joining us.
Pleasure as always, and